September is Ovarian Cancer Awareness Month, and I'd like to share some information with you today. Welcome to Crocks in the Kitchen. I'm Jessica, and I'm the only one here today, although I guess you can count Peef. Yes, September is Ovarian Cancer Awareness Month, and I've always known this. Well, not always, but in the past several years, I've known this because my grandmother actually passed away back in 2009 from ovarian cancer. And it's, so I've always known that this month was Ovarian Cancer Awareness Month, but it obviously takes on a whole new meaning to me this year. For those of you who don't know, which I don't know who that would be at this point, back on June 3rd, 2022, this year, I was diagnosed with ovarian cancer. Now, we are still trying to figure out technically if I'm in stage 3 or stage 4, but I have ovarian cancer and I am 36 years old and it has completely changed my life. So what I wanted to do today is share a little bit about the signs of ovarian cancer and a little bit about testing or lack thereof to find out if you have ovarian cancer. So just kind of wanted to spread some information out there and hopefully make you guys aware of things that I didn't really know before I was diagnosed. And so just hoping that maybe this can help spread some awareness and maybe help somebody else out there detect it earlier, although it is very hard. So the first thing that I wanted to share is just the fact that there's not really one particular sign or symptom of like early stage ovarian cancer. So it's usually by the time that like there are certain like signs that you'll see, you're already really far along. So ovarian cancer is usually actually diagnosed in later stages, like stage 3 or stage 4, because of this. Because the symptoms that show up, a lot of people ask me, like, was there something that you missed or that you noticed? And until May 2nd, I did not have any sign or symptom. Even on this list as I go through it, there's maybe one thing that I could kind of think of that might have been a little bit of a sign. But it's really, really hard to detect. So some of the symptoms can be like abdominal bloating or swelling, like feeling really full really quickly when you eat, which obviously with my weight issues, I never had that problem. Weight loss can be a sign of it. Fatigue, back pain, things like a frequent need to urinate or changes in your bowel habits, or just general like discomfort in that like abdominal pelvic kind of area. So again, all of these things are also signs of so many other things that it's really hard to say, oh yeah, I have this. Oh yeah, I probably have ovarian cancer. Like that's not your first thought. And so when it comes to these signs, I think the only thing looking back that I could say is I always thought like, and this goes back like a few years even, and who knows if this is even related. I always did think like, oh, I feel like I have a small bladder. I feel like I have to pee all the time, but not like a crazy amount. So it's not anything that I would have like red flag. I did have really heavy periods, but that's not even necessarily on any of these lists of being a specific sign. So yeah, it's really hard to tell. I will say that the final thing that got me on the ball rolling to be diagnosed was that I had this pain that started in my like lower abdominal area, and it was a pain that started on May 2nd. And I remember very specifically, and then did not stop. And everybody was like, oh, maybe you pulled a muscle, maybe it's this, maybe it's that. It didn't feel right to me. And that's by like a week from then on May 9th, I was already going to a doctor. So to get checked out. So I think the one lesson from that is if you have any of these kind of signs and they're persisting, they're lasting longer, and something just doesn't feel right, trust your instincts, go get checked out. Because the thing is, like, even as I was driving to the doctor to get checked out for that pain, I thought, oh, I'm wasting the doctor's time. This is stupid. It's probably like I have gas or I have like whatever, like something stupid. And it may just be something simple like that, but obviously for me, it wasn't. So you just never know. So when in doubt, get checked out. Hey, that rhymed. The other thing that I really want to talk about too is that, and a lot of people are like, really, when they find this out, which you'd think it would be common knowledge, but it's kind of like a pap test or pap smear does not detect ovarian cancer. It is a lot of people mistakenly believe that if they go to their yearly checkup every year with their OBGYN, that, they get their pap smear and, they're good and whatever. And like, okay, I don't have any problems with anything in my reproductive area. Well, the pap smear or pap test actually tests for cervical cancer. So that is not like, it does not screen for ovarian cancer. Ovarian cancer will not show up on there. And the thing is, it's like you think you're doing everything you can do, and you kind of are when you go to your yearly checkup. And it's just unfortunate that there isn't a test. And I'll talk about this in a second. There's really no test for ovarian cancer specifically. So you are getting the pap smear for cervical cancer. Now, you should still go and get your yearly checkup. So me saying like, oh, it doesn't test for it, you should definitely still go, because there's other things that it does screen for, and it's really important to do that. And I have been going every year since, I don't know, maybe I was like around 25 or so. I've been going every single year and getting my checkup. There have been years when I've pushed it off a few months here and there. And the last time I had actually gone for my yearly checkup was in October of 2021. And so, and I had pushed it off. Like I probably was due to go in like March of that year, but with everything going on, it was just like, whatever, I'll push it off a little bit. But can you imagine if I hadn't gone in October, where I'd be now, like how I'd be feeling now, because I'd be in a whole different place. Like the fact that I went and I did everything I could possibly do is one of the things that saves me when I get in that loop of, is this my fault? What could I have done differently? All that. At least I know I went in October of last year for my checkup. So I wasn't like overdue. Now, the one thing that they do at your checkup, you probably know, is like the pelvic exam, where they feel around your ovaries and all that kind of stuff and make sure that everything feels, pretty good. Now, this can help detect ovarian cancer, because they could feel a mass. And, I actually have a friend who, that's how they were detected that they had ovarian cancer, was that their doctor felt a mass. Now, by the time my mass got taken out in June of 2022, it was approximately the size of like a tennis ball, but back in October, it probably wasn't. And so it didn't, my doctor felt and did all that, but it was not enough. Who knows when the tumor started growing, how big it might've been at that point. We just don't know. And so, yeah, it's still important to do that, but just know that it doesn't clear you of like, oh yeah, I don't have ovarian cancer. So yeah, apparently like 2/3 to 3/4 of all ovarian cancer cases are diagnosed at such a late stage, where it's already spread and it's already starting to like spread into other areas or other tissues. And that's what happened with me. And that's why the symptoms finally started showing up, because, this tumor is like encasing my ureter and causing me to have like issues with my kidney, and is causing, possibly my ovary might have like had torsion where it twisted on itself. And that's finally what kind of alerted everything to, hey, there's something going on in here. Let's see. So why isn't there a test that they do every year to screen you for ovarian cancer? Well, they just don't have a test. They've been trying to develop a test, but they haven't had much success in doing that. And so the two things that are most often used to screen for ovarian cancer is actually either a transvaginal ultrasound or the CA-125 blood test. So let's talk about both of those. So I had an ultrasound only after I had those symptoms. So it's not something that they're going out of their way to be like, okay, we're going to do an ultrasound on everybody every single year. We're going to do, whatever. It's only these tests are really only done when other issues come up, and it's like, oh, hey, we should probably check it out and see what's going on. And that's what happened with me. And when they did the ultrasound, they did find that there was a mass, but a lot of most, and they told me this when I got it. It's like most like cysts and masses and stuff in your ovary are benign. So, but the ultrasound does show them a clearer picture and they can get a better look. And that's how they got the ball rolling to figure out what was going on with me. The CA-125 blood test is something that they didn't do on me until I was actually in the hospital. I think even like a day or two before I had the surgery. They did some tests, a few different tests, and one of them was the CA-125. Now, my numbers were not elevated. So not everybody with ovarian cancer will have elevated numbers. There are also other reasons why your CA-125 level could be elevated. So again, not necessarily something that can be used to screen or indicate that you have ovarian cancer. But I think for me, it just seems like, and I'm no expert in any of this, but it seems like, there would be a point where, I don't know. I always like to say, like, I feel like everybody, like every few years or every year should have like a full body scan to see what's going on over there, because we just don't know. And so, like, I know that's not practical, like insurance probably, like, if you just go, oh, hey, I want to do a full scan of like everything in this person, like with no reason, like they're not going to pay for it probably. So it's a whole other issue, but it just seems like we have the technology to know these things, but we just can't, it's unfortunate. If the thing is, like, if you don't have any symptoms, there's no, like I said, there's no test, there's no screening for ovarian cancer. And that just kind of like leaves people in my position where, you will just find out because you have another issue. And I'm lucky that they found out as soon as they did, probably. Like, if I hadn't had that pain that started, which probably resulted from me riding my bicycle the day before and doing something with causing it to twist or something like that, I would have never like found out. And so, I mean, obviously I would have found out at some point, but how much later and how much longer would it have taken to find out? So yeah, they did say that in some of the research that I was doing, that the reason why like the transvaginal ultrasound and the CA-125 tests aren't like just regular standard tests, because when they found that doing those didn't actually lower the number of deaths that are caused by ovarian cancer. So it's kind of like one of those things where I guess they're like, well, if it's not, but I don't know. Again, take the information for what you will. I'm just trying to kind of spread and educate and encourage you guys to do your own research, to listen to your body, to go get checked out if you think there's something wrong. And so that's kind of my conclusion is like, so what can you do? Because this all kind of seems like, it's like not good news, because it's like, yeah, there's really nothing you can do, but you can continue doing your yearly screenings. Listen, like I said, listen to your body, be an advocate for your own health. I've learned I have to do that. If you think something is wrong, definitely, because along the whole way of my process, everyone was like, well, you're so young. Like there's no, the odds of you having cancer are so low, but you just never know. So, I hope that you guys have enjoyed this information, and that this will just, help spread awareness of ovarian cancer. And I don't really know what else to say, but if you haven't subscribed to our channel, please subscribe for more videos. We will be continuing to do updates on my cancer. We'll have more updates on like the actual health aspects of what's going on. I have guests that I'd love to bring on to give you guys tips and stuff like that if you're going through cancer, or like, related to like specifically what to eat and that kind of stuff. I definitely want to get into a lot of that. But we'll have recipes coming out as well. My husband and I do whole food plant-based recipes. We've been doing that for, I don't know, gosh, 3-4 years now or something. And that's kind of our main Crocks in the Kitchen shtick, but we've kind of refocused a little bit on me for the time being. But I think that's all I got. Did I need to say anything else? I don't know. But I think I'm gonna say goodbye and call this one. So see you next time. Bye.